what if retinal laser is done only for one eye in diabetic retinopathy? This is Dr. Anina Abraham. I'm a retina specialist at Advanced Retina Care Hyderabad. The reason why I'm making this video is because we had a patient who came after undergoing laser only in one eye when he was diagnosed to have proliferative diabetic retinopathy a year ago, only in that eye because the doctor did not see the new vessels in the other eye, and did laser only in one eye. Now what happened is you can clearly see the difference between the retina of a lasered PDR or proliferative diabetic retinopathy versus the retina of the unlasered eye. And this clearly shows the benefit of doing laser versus not doing the laser. He had bleeding in that eye, there were membranes forming, he was going into a retinal detachment. All this happened within this 1 year. The reason why he refused to undergo treatment in that eye is because the vision was normal. Vision can be absolutely normal and you can have very advanced diabetic retinopathy. Remember, diabetes is a condition which runs in your blood, so it has to affect both eyes simultaneously. Whether it's diabetes, whether it's blood pressure, if you have hypertensive retinopathy, it will happen in both eyes simultaneously. You cannot have only one eye having diabetic retinopathy and the other eye absolutely normal. That is not possible, especially when it is an advanced stage of retinopathy. Most likely the other eye also is in an advanced stage. There are these subtle blood vessels which need to be picked up. Those subtle new blood vessels could be on the optic disc and could be so easily missed. It's extremely important to look carefully in the other eye for changes of the same proliferative diabetic retinopathy. So the reason why I'm making this video is, if you have undergone laser treatment in one eye for diabetic retinopathy, please undergo laser even in the other eye. Laser is extremely beneficial and prevents all these complications like vitreous hemorrhage, which is bleeding inside the eye, tractional retinal detachment, or detachment of the retina from the underlying layers. All this cause loss of vision. If you're treated on time, you can prevent all these problems. Now this is a case which has undergone laser, and if you can see, these marks are all blackish pigmentary marks because of the laser which has been done in this eye. This is the central portion of the retina which is not lasered, but the periphery of the retina has undergone laser. So because of this, his vision is preserved. What has happened here is the area which is not receiving blood flow has undergone the laser treatment, and as a result of that, his vision is preserved, the healthy retina is preserved. Laser has so many good effects and it actually prevents blindness in diabetic retinopathy.